For everybody who's listening or will be listening, I'm Dr. Carlos Grandela from ViewFinder Low Vision. This is our April informational webinar, and we do an informational webinar every month just to bring up different topics in low vision that we think our patients and people in Arizona and anybody else who might be listening can benefit from. We did transportation last month. We'll be talking about vocation and employments next month. And this time we decided to pair up with the Phoenix VA medical system and talk with Mr. Thomas Hicks and Dr. Melissa Schiffer about the Veterans Association and Veterans Affairs Department and everything that you guys do to give back to the servicemen and women, especially those who have ocular disease and find that they need something beyond the glasses to help them get back to independence and back to daily life. So for starters, could you give me a brief introduction about the two of you, where you're from, maybe where you went to school, something funny about you? And we'll talk a little bit about the 3 VA centers in Arizona, and then we'll kind of let you guys dive deep into what is it really that you do and makes your unit so special.
Okay, go ahead, Dr. Schiffer.
Okay, I'm Melissa Schiffer. Nice to meet all of you. I'm from Wisconsin, like Dr. Harrier, I believe, that also works at ViewFinder with Dr. Grandela. I'm from the other side of the state, though. I went to college up in Minnesota and then optometry school down here in Arizona at Midwestern University, Arizona College of Optometry, and then went on to residency at the Birmingham Veterans Hospital out in Alabama and the Blind Rehab Center out there as well in Birmingham, and then came back and started working at the Phoenix VA doing low vision exams part-time and then working in the general eye clinic doing regular eye exams part-time as well. Tom?
All right. I'm Tom Hicks, and I'm from Anchorage, Alaska. I graduated college at Western Michigan University, where I earned my degree in vision rehab therapy. Been working at the Phoenix VA as a visual impairment services team coordinator for the last 14 years. I'm also a blind veteran, so I've been blind for 24 years, and I've been through the comprehensive inpatient program that we'll talk a little bit about later at the Southwestern Blind Rehabilitation Center. I don't know if this is a funny fact about me, but I have 7 children, 4 sons and 3 daughters.
Wow.
They range in age from 14 to 33. I'm just a super tired dad. I'm ready for them all to just move on and just take care of themselves.
That's amazing. Wow. I've got 3 kids. I'm not up to 7 by any means. I don't think my wife will let me, but that's incredible.
I got a dog, guys. That's my child.
If Dr. Harrier was here, that's what she would say too. She's a husky mom. So I don't know how they do so well in Arizona, but.
No, they're getting hot. Yeah.
Yeah.
Great.
So
go ahead.
Well, I was going to say people might wonder why ViewFinder, a private company, and the Veterans Group might partner together in taking care of veterans. And so just to explain a little bit about ViewFinder for those who don't know us and might be coming on just for information about the veterans, we are a private low vision rehabilitation company. We've got 2 doctors, myself and Dr. Harrier, and we typically don't do general eye exams. Almost all of our patients have a specialist of some kind, whether it's retina or glaucoma or a general doctor who's referred them over. And we really focus on the functional side of things, whether it's magnifiers or electronics or specialty glasses. And it's very goal-oriented. Dr. Schiffer, I think, is going to talk a lot about that as well in her clinic, that we're really focused on what the patient needs, what they're coming in to do, and we try to tailor our solutions and our resources towards that. So we get, I think, a little bit of the overflow from the Veterans Affairs Center, and we get, I think, people who don't know about those services filter into us, and then we forward them on and say, the Veterans Department has a lot of things that they can do for you. Let's get you in the right hands and get everything taken care of, because unfortunately, Medicare and other medical insurances don't cover pretty much anything out of glasses or low vision devices, whereas the Veterans Affairs Centers do quite a lot to help the veterans out. It's really amazing what you guys will do. So that's a little bit why this tag team is even here in the first place.
Mhm.
But Tom, go ahead with what you were going to say.
Well, we appreciate, working with ViewFinder to help us identify those veterans that don't know about us.
Yeah.
So it is a partnership to help us get the services they need and they earned as veterans serving our country. So thank you for doing that.
Mm-hmm. Absolutely.
So I'm going to pull up a couple of quick slides here and kind of give a real brief rundown of the different centers. And then we'll turn time over to you guys to talk about the Phoenix Center and the Advanced Low Vision Clinic and what you guys do there. So let me switch that over here. Learning all this different technology stuff. Can you see that presentation?
Yep.
Okay, wonderful. Make sure this is all coordinated over. Beautiful. Okay, so low vision services at the Veterans Affairs Medical Center. That's our topic today. The Phoenix Veterans Affairs Medical Center is over on Indian School Road in Phoenix. Phone number for those of you who aren't visual, maybe listening into this, is 602-277-5551. And of course, Dr. and Tom, if I mess any of this up and you have a better number, feel free to chime in at any point.
Okay.
So they were founded in 1951 with a lot of effort from Senator Carl T. It's supposed to be Hayden, not Hardin, and President Harry Truman. Manages the health care of over 90,000 U.S. veterans here in Arizona. And I believe it was in 2016 saw over 1 million outpatient appointments. Just amazing to be churning out that level of health care. There are partnering clinics underneath the Phoenix VMC in Globe, Gilbert, Payson, Show Low, Thunderbird, which is the west side of Phoenix, and Surprise. So all around the Phoenix metro and up into northern Arizona, we've got these satellite clinics that do a lot of the work so that you don't have to drive all the way in. The Advanced Ambulatory Low Vision Clinic is up on the second floor of the main building. Like we were saying before, typically you're referred to low vision by a general eye doctor or by an ocular disease specialist, looking for solutions like glasses, optical magnifiers, video magnifiers, and other electronics and assistive devices, possibly bioptic telescope glasses for driving, filter lenses for glare, lamps for task illumination, flashlights, things like that. There's a whole multitude of different devices you might be looking for the particular hobbies or vocations or different things you're trying to do.
Mm-hmm.
We also have in Tucson another Veterans Affairs Medical Center. That's down on 6th Avenue, and the phone number for that is 520-792-1450. The Tucson Center was previously known as Pastime Park. I guess this was a recreational center for quite some time and had a history of being a skate rink and a bowling alley and a couple different things. Became a temporary veterans hospital in 1919, and a lot of people came out to Arizona at that time because of difficulty with tuberculosis. I imagine it was the same up in Phoenix as well, and became an official veterans hospital in 1928. So that one was there a little bit earlier than the Phoenix Center. Currently serves 170,000 veterans across southern Arizona and into New Mexico, and about 700,000 appointments per year. So between those two centers, almost hitting 2 million people in a year. Tom, were you going to say something?
No, I'm glad you hit on the tuberculosis asylum. It's a really beautiful campus. I've been told it's very southwestern and looks like almost like a old hacienda kind of thing.
It does. I've had the opportunity to tour through it. It's a pretty amazing place. And I think you said you were down there at the blind rehab. Is that right? At some point?
Yeah, I've been an inpatient there before I worked here.
Mm-hmm.
And yeah, just really a great experience for me as a veteran, super supportive, and I'm, probably the reason I'm able to work today and function at the level I am is because of the training I received down there.
Yeah. So the Southwest Blind Rehabilitation Center was founded in 1994, and like Tom said, it's an inpatient program. So you're going to be going in and staying there for, I think it's a couple of weeks. It's a comprehensive rehabilitation training, looking at things like orientation and mobility, so being able to navigate and walk around in unfamiliar territory. Communication skills, which can be difficult if you're not able to see the person's face that you're talking to and read body language and some of these other things that we may take for granted as a sighted person. General activities of daily living, manual skills. I know they have a wood shop over there, which I thought was amazing. A lot of really good craftsmanship that they're teaching. And I read an article on the website today that they're working on hydroponics as well, which I thought was also a very in-depth skill to be teaching in a center like this. Amazing that can be done. General visual skills, computer access training, which is very important, social and recreational activities, individual counseling, and group counseling, which those of you who stop into our low vision support group can know that counseling is really important. It's hard enough to have low vision. It's harder to do it by yourself.
Absolutely.
And then we also have the Prescott Center. I think it's the Northern Arizona Center is what it's officially called. And that phone number, so that's up on Highway 89 North in Prescott. And the phone number for that is 928-445-4860. And the Prescott Center originally was called Fort Whipple, was an important U.S. military base through a couple different wars, became a sanatorium and a hospital, and became an official part of the Veterans Affairs Administration when that was opened up in the 1930s. It currently serves about 30,000 veterans in northern Arizona, and it has an optometry department, but unlike our other two centers, does not have a low vision clinic. So if you live in northern Arizona and you think you have low vision, you likely want to go in and be seen for an eye exam up there in Prescott and later referred down to one of these two centers for that continued training, access to some of these devices.
Yep.
There's many partnering organizations throughout Arizona that work alongside with the veterans. The Arizona Center for the Blind and Visually Impaired, Savvy Services for the Blind, Foundation for Blind Children. These are all nonprofit programs that offer a lot of training and specialized skills. And while most of this you'll likely be able to get in-house in the veterans community, there may be times where a veteran gets referred out to one of these organizations or a specialist comes by to do some training, as well as additional Arizona state programs like the Rehabilitative Services Administration. And of course, Tom and Dr. Schiffer will elaborate on that for us. As well as private vendors, private doctors in the area that are providing some of these tools. And that's really where ViewFinder comes in. We're a private doctor and vendor. So we may sell things to vendors, to veterans through the association, through the department, or we may see a veteran and pass them on forward to get that continued care. So a lot of stuff going on in Arizona, a lot of resources. A couple different places that you can go as a veteran to get your eye care started. But in the end, we really want to talk about Phoenix. So we're going to turn it back over to you guys and tell us a little bit more about the Advanced Low Vision Clinic and what makes you guys special. And for people who may have never known that they could have low vision, that was even an option to come and talk about that. Let's deep dive.
Great. Okay, so Tom, do you want to go over kind of what you do, your role, and then Bros, and then I'll talk about ALVC?
Sure. So the Visual Impairment Services Team Coordinator, I am like the point of entry into our continuum of care. So when routine eye care can no longer help a veteran correct their vision to near normal, and they get to that 20/70, between 20/70, 21/50 range. They're very visually impaired, but not quite legally blind, 20/200, or their visual fields are less than 20 degrees. When they start to exceed that range, they're going to go right into our low vision clinic. Though then if they get worse than that, if their vision becomes blind, then they'll come to me. That's kind of the old paradigm. Now we're providing lifetime case management for not only the legally blind veterans, but also the low vision veterans. And that's a new shift, just happened last September. I think it's because our World War II veterans are leaving us at a rapid rate, and we're trying to get out in front of identifying veterans with these progressive eye conditions that could lead to blindness, so that we can help mitigate that and make it better for them if and when they do become blind. So my role is just to get a veteran eligible with the VA healthcare. That's step one, is they have to get registered to be eligible to receive care. So they need to be honorably discharged. And then if they make too much money, because the VA is kind of based on your means. So if their income exceeds, let's just use $45,000, $47,000, then they would be in a copay status potentially, or they would be rejected even if they had an honorable discharge. So then if they're legally blind and their income still exceeds those thresholds, we process, once we verify that they're legally blind, we declare them catastrophically disabled, and then we make them eligible. And the good news about that is there's no copay for specialty care, primary care, and certainly no copay for vision, prosthetic aids, devices, technology, training, none of that. So I guess there has to be an advantage if you're going to be losing your vision and you're a veteran. That would be the advantage. So me and our blind rehabilitation outpatient specialist in Phoenix, his name's Carl White. He provides services in the home for veterans. And in an ideal situation, our veteran would be referred to the Southwestern Blind Rehabilitation Center. They would get their comprehensive services, their training, all their devices, everything would be sent home with them when they meet their goals. And then we in Phoenix would support them. So if they needed refresher training or they needed their equipment replaced, we would support them in their home here locally. If their visual status were to get worse or their living situation changes, then we can reevaluate them and help them with those new goals and send them back to the Tucson Southwestern Blind Rehabilitation Center as many times as it takes to help that veteran remain safe and independent, and sometimes just improve their quality of life, because it is challenging living with blindness and low vision. And then so when routine eye care can no longer correct the veteran's vision to near normal, then they would get referred to Dr. Schiffer. So I'll turn it over to you.
Okay, great. So similar to what Dr. Grandela was saying, our patients are referred in from their specialists, whether that's retina, glaucoma, neuro, their general optometrist that they're seeing, to focus more on a functional vision exam to help you meet goals that you currently cannot meet because of where your vision is at. So typically our old standard was you had to be worse than 20/70 to be seen in our low vision clinic. That's no longer the case. I take patients that maybe just have mild vision impairment, whether that be 20/40, 20/50, because I feel like it's crucial to get patients in early when they have a progressive eye condition, so we can be training them on those devices, those magnifiers, when they still have more usable vision. And I'm sure Dr. Grandela, you may agree with that.
Absolutely.
As well. The earlier, the better.
Absolutely.
So we can kind of, start that continuum of care. I'll do a trial frame refraction and then do device evaluations. I typically focus on optical devices, and then I have my support staff of therapists in our clinic as well that our patients will likely see, not maybe one or maybe all of them, depending on their goals. We have a low vision therapist who does things such as lighting evaluations for direct task lighting, for near tasks, or lighting in the home, and training on the devices. We have, and that's Lynn Terrazon, our vision rehab therapist, Ebony Lewis focuses on activities of daily living, whether if you're struggling in the kitchen, there's adaptive devices for the kitchen, high contrast cutting boards, larger print measuring cups, things like that. She focuses on access technology if you need help assistance on the phone, computer. And then she also does a lot of our tint evaluations because a lot of our patients with glaucoma, macular degeneration, any sort of eye condition might have extreme glare sensitivity inside or outside and need a special type of tint on their glasses to help their eyes feel more comfortable. We also just got an orientation and mobility specialist who is full-time. Yeah, it's really great. We really love her too. Her name is Julia, and she assists with cane training. She also does, I know you guys, it sounds like you had a webinar on transportation, so she can go do routes on the light rail or bus routes with the Valley Metro with the patients if they want to do a route with her.
All risk assessments and things like that.
That's great.
Yeah. And so just like Tom said, we provide lifetime case management. We provide services as needed. We really try to drive home that it's crucial that you have someone managing your ocular health and see us, whether that's every year, every couple of years, come and see us in 6 months, whenever a new goal arises, if you need assistance.
Absolutely.
We talked about where we're located. As far as getting in contact with our clinic, I sent Dr. Grandela our PowerPoint, which I apologize we were not able to bring up because of our technical difficulties. But at the end of the presentation, it actually has direct extensions for our clinic. And our main contact is our program support assistant, William Isle. And his extension after our main number that Dr. Grandela said was 5561. And that's in the presentation. You can certainly take this presentation and post it or provide it if you would like to, because that's a really good thing to have our direct extensions when calling into a big hospital, just to ensure you're not going to get shuffled around because there's a lot of people here. So, okay, let me just make sure I hit everything with our low vision clinic. One of the bigger things I think Tom already mentioned, like he said, we're a non-copay clinic, so anything that I recommend as far as optical aids, like magnifiers, whether it's traditional magnifiers or electronic, there's no cost to the veteran. And similar with any other devices or prosthetic aids, our therapists recommend, which is a really great thing that the VA is able to provide for our veterans.
I think what's interesting about our advanced ambulatory low vision clinic is we can receive referrals from out of state, and we do receive referrals from Prescott, and sometimes, believe it or not, even Tucson. But we have served veterans in other states who will come here and they can stay in a hoptel, which is we'll coordinate a hotel, usually the day before, and they'll get to stay overnight there, and then they come to their appointments in the morning. And if sometimes those appointments might take a couple of days, the VA is going to cover those hotel costs for them as well. So that's a real nice benefit for our veterans, especially when they're traveling from far away. The other interesting thing is, if you can imagine this, because everybody that's listening who is low vision, they understand how frustrating that is. But can you imagine a veteran being told, you're not blind yet, come back when you're blind and then we'll help you? And that's what it used to be. That's how the VA used to treat veterans. If you weren't legally blind, there was nothing for us to do for you because we didn't have a program. We didn't have anything. We couldn't even see you. So only since 2008 has the Advanced Low Vision Clinic here in Phoenix been operational and serving veterans, and it's just been a really good part of making Phoenix more robust in identifying those veterans before they get to that blindness. And then what I can say personally is I've noticed that our veterans who come through the low vision clinic and make their way to the visual impairment services team, when they do become legally blind, it seems to be a lot better for them because they're kind of informed, they're aware of everybody and the services, their adjustment goes faster and they're more receptive to receiving that inpatient care versus being afraid of it or not trusting, because the VA is always overcoming trust issues, I've noticed since I've been here. Don't you think?
I think so. Yeah, it's been a lot easier of a transition for me to refer them to you. It's never an easy day to tell someone they're legally blind that they've made to that, but then I can say, well, now here's where we go from here. Now you can go to Tom Hicks, and there's more opportunities and more things that we can help you with.
Yeah, exactly.
So, and we certainly appreciate, Dr. Grandela and Dr. Harrier, because like Dr. Grandela was saying, they're identifying veterans who, had no idea we had services. They're able to see veterans if I'm super booked, because I'm only doing it 2 days a week. So it's a really great relationship to have. And I'm glad that since Dr. Grandela has come into the practice, he wants to maintain that relationship. So we're really happy about that.
Yep, absolutely.
Now that I've got your presentation up, are there any slides you'd like me to go back to?
I'd say slide 11 has the contact information on there, so that would kind of be a good one just to kind of have up if patients wanted to write that down or have someone write that down
Absolutely.
for them. Again, our main point of contact is William. He's the program support assistant at 5561. Tom has his extension on there, and then our therapist as well. I would say, a lot of, our therapists go out to the homes a lot for the veterans as well. So if you call and you get a voicemail, just leave a message. Just give us a couple days. We'll get back to you. We're always running around, so just be patient with us. But please feel free to leave a voicemail if you want to get, involved with our clinic.
Yeah, unfortunately, we don't have services for a veteran's spouse when they're visually impaired, but many times those devices that we're recommending for our veterans certainly can be used for the spouse. And when our veterans pass away, that property is their property, so they don't have to return it back to the VA. That can be left for the spouse so they can benefit from the low vision devices if they need them. So some people think that they have to send all that stuff back to the VA because it's the property of the government. And it used to be that way. It's not that way anymore. So once we issue a device, regardless of the cost, if it's been issued to the veteran, it becomes their property.
Oh, did you want to talk about Spencer?
Yeah, Spencer up in at the Northern Phoenix VA healthcare system. He is also a visual impairment services team coordinator, but he's got a background. He started out at the Southwestern Blind Rehabilitation Center as an instructor down there, and he's also worked in Washington, so he's kind of done the blind rehab outpatient specialist role too. So he's a jack of all trades serving our veterans up north. He's doing a really good job. But when that care kind of exceeds his capabilities, then he gets people like ViewFinder involved, or he'll refer to our low vision clinic. Or if a patient is legally blind, he'll prepare them for that program down in Tucson.
So Prescott does have blind rehab services. It's small. It's small. It's one guy, one desk coordinator up there.
Yes, he's a what do they call a one show pony?
Yes. yeah.
That's wonderful.
Exactly.
I slowly went through each of the slides in the presentation here. There's some really good points about, don't touch somebody's guide dog, how to interact with somebody who's visually impaired or blind. So for anybody who's watching, you can pause the screen on any of those that I walked through and take time to read that. There's some really good pointers, good things to tell friends and family who may not be aware of how to talk to somebody or how to interact with somebody who has vision impairment. Really glad that you brought that in. And thanks for the correction in Northern Arizona. So we do have somebody up there then.
Yes.
That's great.
Thankfully. Yes. Exactly. And a lot of times, like Tom was saying, they will come down and see me for a low vision exam, and we have the capability of setting them up in a hotel like the night before or the night after the exam. If they're going to see me and the therapist as well, so we can it's not as much of an issue for them to make that trip.
Well, it's safety too. We don't want them all that driving when they're exhausted and things. We don't, not that the veteran would be. Hopefully, the veteran's not driving to their own low vision appointment.
Yes.
That's kind of scary, but sometimes we have to have that difficult conversation with a veteran. Even recently, we've had to tell a veteran, you just aren't safe to drive. Don't be doing that anymore.
Yeah. So speaking of driving, I think that's a really good point to ask a couple questions. So one of the questions I had asked before was about bioptics. So we know in Arizona, for anyone who is 20/70 up to 2200 in their best eye and has at least 105 degrees of visual field, they can be qualified through a bioptic telescope to drive should they meet the right parameters, get the right training. Is a veteran able to do all of that through the Advanced Low Vision Clinic and have everything set up through ADOT? Would you talk about that, please?
Yes, absolutely. So we get referrals in for that quite often. We'll, make sure obviously that they meet all those requirements with visual field and, stable vision, and I'll fit the telescopes, order them. As far as training goes, I've started to do that here, but my timing is a little bit limited. So depending on where they live in the valley, I've referred to ViewFinder in the past for training, or Midwestern University. They have a low vision department there as well. So kind of whatever is easier for the veteran. And then I have done a couple of trainings here, like I said, myself. But again, if I'm really booked out, I will refer out just so we can get them to behind the wheel training in a timely manner. So for me to issue and prescribe and authorize a bioptic, I require that the veteran do go through behind the wheel training with driving to independence. And I think that you guys are also very similar in realizing how important that is. And that training, in addition to the devices and the telescope training, is all covered by the VA. So the cost of any of the training and the devices would be covered. And once a veteran goes through our training or the training with our private doctors and the behind the wheel training, then they will get issued that driver's license that says they can drive with the bioptic. So, so we rely a lot on our community to kind of help that process.
It's a lot to get done, especially that first year. From going from, being able to drive just fine to maybe it's macular degeneration has made things worse. Going through the evaluations, getting the training done. The out-of-pocket cost for a bioptic is very high, can be up to $2,500 depending on, prescription and things like that, the power of the telescope that they need to use. But I 100% agree that they need someone who gets in the car with them. Even if you're fully visually qualified, you may just not be a good driver. And so, you do need somebody to get in the car with you. And unfortunately, Dr. Schiffer and I aren't qualified for that. Maybe thankfully, we're not qualified for that.
Thankfully, yes.
I don't know that you'd want me in the car with you, according to my wife at least. But yeah, driving to independence, it's a great program. I think they're the only ones in Arizona who work specifically with vision impairment. And they are occupational therapists as well.
Aren't they out of Tempe?
Yes.
I think so.
In Tempe.
And so once a veteran graduates from driving to independence, then they get like a certificate that they would present to the Arizona Department of Motor Vehicles, right? And that's only good for what, a year?
Well, the training is good indefinitely, but depending on their eye condition, you can recommend that the patient get their vision checked through the bioptic every 1 year, every 2 years. It just kind of depends. It's kind of up to the doctor who prescribes that bioptic, how often they want the patient to have their vision checked through that telescope.
But it's usually considered a restrictive license.
Correct.
So that's a great point to touch on. I had a few other questions. I jotted down things that I know veterans have asked to me before, and maybe some of the people who watch will think about a little bit. So there's a whole team that they get to participate in with your department. It won't just be one doctor or just a visit with Mr. Hicks or something like that. but they'll get to see multiple people to help them work through the goals that they're trying to get to, whether it be driving or reading or working. So at what point would they shift from seeing someone like Carl White for a home visit to doing the inpatient service down at the Southwest area in Tucson?
So that's something I can tell you about. So first of all, I think every team member we have they have some type of a personal connection to visual impairment or blindness. It seems it's not mandatory, but I've just noticed that they do. And our team seems to be good about encouraging those veterans and educating them and letting them know what their options are. So if Carl's out in the veteran's home and he's noticing that he can only get to them every so often. So if he's noticing, your needs are greater than what I can provide you on an outpatient basis, then he might refer them back to me to get them ready for that inpatient program. When that happens, I'll schedule them for several appointments. They're going to see a medical doctor. The doctor's going to give them a physical. It'll usually it'll include an EKG, chest x-ray, fasting blood work. Just want to make sure that their veteran is medically stable, so nothing interferes with their inpatient program. Then we're going to get their hearing checked and audiology, make sure that if they have a dual sensory impairment, we're addressing that, helping that veteran so they're not dealing with dual sensory impairment during their rehab program. Then they're going to come see Dr. Schiffer. She's going to give them an ocular health exam, make sure that if there's anything we can do, to preserve vision, improve vision, that's going to be addressed first. And that the Tucson Blind Rehab Center kind of understands just, the total person. This is their health picture. Then me and the veteran will sit down, we'll do a full intake. We'll kind of identify, who they are as a person, where they live, what are their functional limitations right now, what are their personal goals, what would they like to do, are they suicidal, do I need to get mental health involved, and then once we determine that they're medically stable and that they've been cleared, then we would update a national database and submit an application to Tucson. It takes about a couple of weeks for that application to be rescreened by their medical team, their rehab folks, and then they will usually contact them and offer them an admission date. Now, you had mentioned that a veteran's down there for a couple of weeks.
Yeah.
They could be there for a couple of weeks. I've seen them down there they've been down there as long as 10 weeks. It's up to the veteran and their goal. It's pretty much tailored to their needs, and whatever those needs are, during assessments, they'll kind of do an initial treatment plan and that set a tentative discharge date. I can tell you on average, a veteran is there for about 4 to 5 weeks, and they're only there because they want to be. I mean, trust me, some of them don't want to discharge. They love it down there, but the goal is to make them independent and help them to gain that confidence and good skills, so that when they get back home, they can just enjoy their life again to the best of their to the fullest of their capabilities. So that's how we do it. That's called a visual impairment services team review. It's called a formal review because it has all those medical appointments involved. We do all of those appointments in one day.
Wow.
And and we have a volunteer that helps escort them around so they're not getting confused or disoriented. Especially if they don't have a family member or friend helping them around the hospital, we'll make sure that they're not getting lost. And every person along the way that day is encouraging the veteran, getting them excited about the Blind Rehab Center. So really, by the time they get to me and Dr. Schiffer, they're excited. They want to let's go, let's do this. So it is a good process, and I'm really proud of what we have here in Phoenix.
I'm glad you clarified some of those things. That was my next question, was how long should they expect to be there and how long all that testing will take place. So to know that all gets done in one day, that's a great thing. And then to know that there is some flexibility in the schedule. I've had the opportunity when I took my tour through there as a prospective resident, I was very excited to talk with some of the veterans who were there, and everyone seems very excited, very upbeat and optimistic because they're learning and they're growing and adapting. Low vision and blindness can be very frustrating and feel very isolated and held back, and
Yeah.
instead you're being propelled forward in this program.
No, and I think in the inpatient setting, when you're down there with other veterans, that's like medicine for your soul. That direct peer-to-peer, that's really uplifting. And you're always going to come across this 90-year-old, 100-pound veteran, lady, and she's going to be, so tough and resilient. And you're going to be this big 200-pound guy, and you're going to be like, hey, she can do it, I can do it. So that's the power of veteran, inspiring each other. That's what I like. I guess one other caveat would be, because of COVID-19, we're wanting our veterans to get vaccinated. And so they need to be 2 weeks from their last vaccination would be when we would want to apply for them if they've gone through the whole process. And they still are following the CDC guidelines, social distancing, and the mask wearing. They're still being very cautious down there. And to my knowledge, no veteran that I've sent to blind rehab during COVID has got sick in blind rehab. So it's working out. It's taking care of the veterans, and they're still getting access to that care.
Yeah. So following up on the peer-to-peer, are there any support groups that veterans can be a part of that are specific to eye conditions, specific to low vision?
We do. We have a support group that meets the second and fourth Tuesday of each month from 10 to 11. Right now, the platform we're using is Microsoft Teams.
Okay.
So if any of your I guess veteran clients want to participate in that, they could just get a hold of Will, and he'll get them that information so they can click on the Teams meeting that day.
You said that was the second and fourth Tuesday of each month?
Yeah. Yes, sir.
Wonderful.
From 10 to 11. And that support group's been going for about 8 years now, so they're a pretty good group of people.
I bet. And then just to reiterate, you did mention this, but so if a veteran has a spouse or has children that have low vision, what level of support can they try to have for those family members?
Yeah, so for any type of medical care or any visual aids or anything, we don't have anything that we can offer them. Our team, if devices are donated back to us when veterans pass away, we do and we will provide those to our veterans' surviving spouses. We do that all the time, just to be, that's what our veterans would want.
Yeah,
we are not, and we're not allowed to reissue equipment like that. So when it gets donated back to us, we disinfect it and we make sure it's serviceable. Many times we're donating that back to the community.
Right.
But if we find that if we come across a veteran spouse who's visually impaired like that, yeah, we're gonna take care of them, and we do.
Wonderful.
So yeah, that's a good question. I wish there was more we did for those veterans. I can tell you from a benefits perspective, if the veteran is service connected, 100% service connected, that surviving spouse would be eligible for dependent indemnity compensation. So they would get a portion of the veterans, they call it survivor's benefits. So it's not a great deal. It's not a great deal of money. But I think right now it's about maybe $1,300 a month.
That's still significant.
That could be helpful.
Yeah, that was actually my next question as well. Was did you accept devices that a veteran might donate upon death? So that is something that you do accept, and that is something that can be given out to surviving spouses or other family members, or other veterans who might need it. It goes back into service again.
Yeah, exactly. Yeah, sometimes a veteran, they're technically a veteran. They served their country in the National Guard, or they served in active duty and they didn't serve long enough to qualify for VA. But we know they're a veteran, so we'll take that equipment that's been donated back and we'll reissue it to them.
Yeah.
Yeah.
The only other question I had written down was for the in-home services. We're kind of jumping backwards here. Is there a mileage limit on how far out you can go before it becomes territory of one of the other VA centers, or before it's out of limit period?
Great question. Isn't that 50?
So Carl has a 50-mile radius.
Mm-hmm.
However, in the Phoenix catchment area, our veterans they're living up in Sholo,
Mm-hmm.
Payson, Happy Jack, Strawberry. I mean, even though it's funny because Anthem is considered the Prescott VA healthcare catchment area.
Really?
So so even though that's close to us, and trust me, we still help those veterans. We're not too territorial like that.
Okay.
And our low vision team has definitely stretched the limits of 50 miles to help a veteran.
Sure.
But yeah, I think for safety purposes, they try and keep the driving down to a minimum. Otherwise, you're not supposed to exceed 300 miles a day in a government vehicle. So. Yeah, other than they want you to pull over and jump in a hotel, and our hospital's not going to do that. So
yeah, that's
so if it gets to be, if it's too much, that's when we would implement the Hoptel and get them in here and make up the difference for them.
Yeah. Well, that rounds it up for my questions. We've actually made it most of the way through the hour. Is there anything else that you would want to add to this?
Just keep taking care of our vets, and we appreciate
it. Keep letting us know if there's new ones that we haven't found
yet. That's right.
Then thank you both for everything you do, and Ebony and Lynn and everyone else who's part of the team, and Carl for what you do to serve these veterans. It's a wonderful thing, and researching today, I realized just how big the population of veterans is out here in Arizona.
It's huge.
Yeah, so it's great to have our private doctors like you and Dr. Harrier again, just to kind of help serve those veterans, because there's a lot of wonderful veterans out there, so it's nice to have multiple providers to be able to assist them. So
yeah,
that's right.
Yeah.